The following segment is sponsored by Innovia Vein Specialty Centers.
Welcome back to AM Northwest. March is Deep Vein Thrombosis Awareness Month. DVT is a serious and often undiagnosed condition with potentially deadly complications. Here to share more, we welcome from Innovia Vein Specialty Centers board-certified vascular surgeon Jason Gilster. Good morning, Dr. Jason Gilster. Good to see you.
Good morning.
So tell me, first of all, explain what it is.
So a DVT stands for deep venous thrombosis, which is a blood clot that develops in the deep veins of the legs, sometimes the arms, but generally the legs.
And what are the typical symptoms? Like, how do you know you have it?
Yeah, most people will develop a sudden onset of pain and swelling in the leg, but unfortunately, some people have no symptoms at all.
What causes it?
Well, there's a variety of things that cause it. There are some genetic factors. We do see some people that will develop them after trauma, like a car accident or surgery, but some people unfortunately just develop them spontaneously.
Is it from being sedentary?
There can be some aspects with that, but I think for the most part, it's some sort of hypercoagulability or tendency to make a clot.
What are the risks, both long-term and short-term?
So short term, we worry the most about the clot breaking off and moving to different parts of the body, specifically the lung. That's called a pulmonary embolism, which can be life-threatening. Long term, veins have valves in them, and the clots can damage those valves and cause long-term pain and swelling. So treatment right up front to avoid that is highly encouraged.
And how does Innovia Vein Specialty Centers diagnose and treat it?
We use technology called an ultrasound, which is an easy test to do, very accurate, no radiation, it isn't painful. We do them right here in our office. And if you're found to have a DVT, we can initiate treatment right away, which is generally using a blood thinner or anticoagulant and compression.
And can you see a difference right away? Do you see relief right away?
Yes, compression we think is very important to get going. That'll help with the swelling and pain, and then the blood thinners will help pretty rapidly within the first few days to weeks.
And can it change a person's life?
Having a DVT definitely can change a person's life. Long term, like I said, it can lead to some long-term swelling and pain in the leg, which can be hard to live with.
Right. So I'm guessing once you get the treatment, it changes you for the better, as in
yes,
feeling
absolutely.
incredibly better. Absolutely. All right. If you would like to learn more about DVT, its causes, and how it's treated, you can call Innovia Vein Specialty Centers at 971-297-3007, or you can visit their website. We'll have a link at KATU.com. Dr. Gilster, thank you so much. Appreciate it.
Thank you.
All right, we'll be right back with more AM Northwest. Don't go away.